In medical school, they teach us about chest percussion, palpation, auscultation, vocal frametus, resonance. So you learn a lot regarding this physical examination. But when you go to clinical setting, you don't have so much time to do those physical examination in a patient, and even if you do those examination, you cannot rely on that. Sensitivity is less. I can say you many cases, like I can even remember now 5 to 6 cases. I did chest auscultation, chest examination. It was unremarkable, but on doing chest x-ray there were cavitating lesion. Even if you say about history, like if you ask respiratory symptoms, patient does not say any respiratory symptoms, but one patient told me that I am having left upper quadrant pain, and I ordered chest x-ray. He had massive left-sided pleural effusion. In western part of the world, they generally do baseline investigations in almost all patients, like CBC, CMP. They call comprehensive metabolic panel, basic metabolic panel, chest x-ray, ECG. But in third world countries, where we have to consider finance, we have to consider healthcare cost that is incurred, we have to decide based on physical examination. We have to consider from that. We even have to think to order LFT or not. It is not like developed nations. We have to think whether we have to order creatinine or not, whether we have to order ECG or not. We cannot order everything, even basic investigations. But as I told you, we cannot even rely on physical examination.